Healthcare is one of the fastest growing industries in the world, and Lehigh is looking to the future. According to the Bureau of Labor Statistics, employment in the healthcare field is projected to grow 16% over the next decade, adding about 2.6 million new jobs to the economy, more than any other field. The new Integrated Business and Health program prepares students to become leaders in this ever-growing industry. The 4-year inter-college interdisciplinary program focuses on the combination of business principles and an in-depth knowledge of health and health policy, empowering graduates to thrive in the global health market. Healthcare is about helping people, but it's more than just treating patients. It's about supply chains, business management, finance, and technology. Lehigh's IBH program will train a new class of leadership in these fields and open the door to exciting career opportunities. The IBH integrated program brings the best of business and health together and prepares students to make an impact in a high-demand field.
Hi, everyone. I'm Beth Dolan, Dean of the College of Health at Lehigh. I want to welcome all of you and thank you for joining us for the 5th session of our 6-session Population Health Colloquium series focused on the business of health. The College of Health has hosted the annual Colloquium series since we opened in 2020. Each series celebrates a milestone initiative or goal for our college. This Colloquium series celebrates the new intercollegiate program Integrated Business and Health, a collaboration between the Colleges of Health and Business. The program welcomed its first cohort this semester, and several of the students are in attendance. If you missed our first 4 sessions in this series, they are now available on the College of Health YouTube channel. We hope you'll join us for our next session on April 7th from 12 to 1:30. That upcoming session's focus is Next Gen Health, Startup Leaders on the Future of Care, featuring Lehigh parent and entrepreneur Mark Tarpenning, moderating a panel of healthcare startup founders, all of whom are Lehigh alumni. Before we get started with today's session, Healthcare Finance Today, I want to offer a few housekeeping notes. First, we invite you to enter questions into the Q&A tab on your screen at any time during the panel discussion. Since we are celebrating a new program, we will try to answer student questions first. So if you're a student, please let us know that you are in the text of your question. Because the new Integrated Business and Health program is a collaboration between the Colleges of Health and Business, I'd like to introduce the College of Business co-director of the program, Dr. Han Yi. Dr. Yi will then introduce today's panelists, all of whom are Lehigh alumni with highly successful careers in finance and strategy within healthcare. Professor Yi received her PhD in statistics and operational research from the University of North Carolina at Chapel Hill. Prior to joining Lehigh University, she served as an assistant professor at the Guy's College of Business at the University of Illinois, Urbana-Champaign, and as a research associate at the National University of Singapore. She is currently an associate professor in the Department of Decision and Technology Analytics at Lehigh University. Her research focuses on data analytics for service operations, particularly in healthcare, with collaborations spanning industry and healthcare partners such as Xerox, Christie Clinic, Alberta Health Services, and KTPH Hospital in Singapore. Her work has been published in leading journals, including the Journal of Operations Management, Journal of the American Statistical Association, and the International Journal of Forecasting. I'll now turn the event over to Han.
Thank you so much, Dean Dolan, for the kind introduction. I'm delighted to be here. We are very fortunate to have an outstanding group of panelists joining us today, and I will introduce each of them. First, Kendall O'Brien, who is a former finance executive at Johnson & Johnson, where she was a key leader in strategic portfolio and financial planning across pharmaceuticals, medical devices, and consumer. At the corporate level, she led the acquisition and divestiture process and partnered with the chief scientific officer on the global innovation portfolio, the launch and investments of the lung cancer initiative, and the expansion of the global public health impact. Kendall is a recognized talent and diversity, equity, and inclusion champion with a demonstrated track record in strong people development. As a mother of two, she is a lifetime advocate for working parents and work-life integration. She co-created J&J's Finance Leadership Development Program and approaches to organizational health. Kendall is the former chair of the Global Women's Leadership Initiative and sponsor for the Finance African Ancestry Leadership Council. She served on several external advisory boards. Kendall earned her bachelor's degree in both accounting and finance at Lehigh University. She serves on the Lehigh University Board of Trustees, the Nature Conservancy of New Jersey Board of Trustees, and the Cranford Downtown Management Corporation, as well as several local community organizations. Next, Denise Faltishek, who is the Chief Strategy Officer and Head of M&A for Tilray Brands Incorporated. In her current role, Ms. Faltishek is responsible for the development and implementation of Tilray's overall corporate strategy, partnerships, strategic investments and acquisitions, as well as Tilray's growth strategies across 20 countries, including the US. As a leader in the global cannabis industry, Denise has played an integral role in Tilray's global expansion, providing strategic counsel to business advocates and regulators in emerging markets relating to drug policy and responsible cannabis reform and regulation across medical markets. Until its reverse acquisition of Tilray, she served as the Chief Strategy Officer of Aphria Incorporated, where she led the company's global strategy, a pivotal role in transforming Aphria into a global cannabis leader. An executive with extensive consumer packaged goods experience, Ms. Faltishek also served as Executive Vice President and Chief Strategy Officer at the Hain Celestial Group, a leading organic and natural products company with $4 billion in net sales and operations in North America, Europe, Asia, and the Middle East. At Hain Celestial, Ms. Faltishek led the successful completion of more than 50 acquisitions and strategic transactions. Ms. Faltishek graduated Lehigh University in 1995 with a BA in Behavioral Neuroscience and the Brooklyn Law School in 2000. She is a founding member of the Brooklyn Law School Women's Leadership Network, which brings together distinguished graduates of the law school to support and mentor women in the law, facilitate networking, and promote career success. Next, Pam Foster-Flanagan, who is a Finance and Operations Managing Director at Accenture, where she serves as the Chief Finance and Operational Officer for one of Accenture's largest global healthcare clients. In this role, she helps teams create measurable value through strong financial stewardship and operational excellence, partnering closely with leadership across planning, forecasting, talent, and delivery to support client success at scale. With more than 35 years of experience spanning finance, operations, marketing, and inclusion and diversity, Pam brings a practical end-to-end perspective on how to build high-performing organizations and enable teams to move quickly and efficiently. Her career includes more than 15 years in external consulting, followed by a shift to business and financial operations, leadership focused on strengthening Accenture's client impact and operational performance. Pam is a proud Lehigh University College of Business and Economics alumni, where she studied finance. Finally, Joshua Raskin, who is co-founder and partner at Nephron Research LLC. Founded in 2017, Nephron is the leading independent research and consulting boutique focused on healthcare. Nephron maintains client relationships with over 180 plus of the world's largest and most sophisticated healthcare investment firms. At Nephron, Joshua coordinates coverage of the payers, providers, and other emerging healthcare service sectors. Joshua also serves as a director or external advisor to multiple private healthcare services companies, as well as private equity and VC funds. Prior to his role at Nephron, Joshua spent 20 years in the equity research departments of Morgan Stanley, Lehman Brothers, and Barclays. Over the past 2+ decades, Joshua has been widely recognized as a top resource in his sector and spent 15+ years ranked in the top 3 in the annual institutional investor poll. Prior to finance, Joshua began his career at Pricewaterhouse in the audit division with a focus on financial services. Joshua also serves on the board of the Parkinson's Foundation, the second largest international NFP focused on that cause. Joshua is a member of the Foundation's Executive Committee, Finance Committee, and Investment Committee. Professionally, Joshua is a board member for Complex Care Solutions and serves as an advisor to Red Cell Partners, RealMed, and Waymark Care. Joshua currently resides in New York City with his wife and 2 daughters. Outside of work, Joshua's interests include crosswords, podcasts, food, philanthropy, and reading the world of fee-for-service healthcare. With that, I'll turn it over to Kendall and our panelists to begin the discussion.
Good morning, everyone. Before we jump into the conversation, we thought it might make sense to provide some context on why we'd have a specific conversation on finance. So if you want to pull up the first slide, starting with U.S. healthcare spend, what you'll see is in 2024, this as an industry was over $5.3 trillion. This is a significant percentage of GDP within the U.S. and in many countries around the world. If you look at the chart on the left, what you see is that hospital is where most of the money is spent. So on the left is where is the money spent, and with the second largest being for physicians. If you look on the right, this is basically who is funding it. Granted, I know consumers help to fund it as well, but you will see that private health insurance is actually the largest funder. However, in media and conversations, you'll see that Medicare and Medicaid combined, which is the U.S. government, make up, almost 40%. So it's a significant percentage of spending, and therefore there's a lot of ways you can experience finance in healthcare. And if you're in the healthcare industry, you need to understand the financial side. Next slide, please. Another way of looking at this, I'm not seeing the slide change, okay, is in this large industry, it is a huge employer. It's the largest segment of employment in the United States with almost 170 million people. So for those of you who are students, there are many people in this market and there's all kinds of jobs available to you. And you can see the many. The fastest growing one, or one of the fastest growing ones, has basically been healthcare and social assistance. You can think about mental health and other things falling into here as well. But as basically one of the fastest growing industries and the largest segment of employment, it's important to recognize many people are in the market, and it's important to the U.S. economy. Next slide, please. A view on that employment as to how important it's been to our economy. You can see healthcare, being the top line, has grown at a much faster rate than the rest of employment in the United States, which we have to thank Nephron Research and Josh for pulling these slides together, because I have to tell you, I didn't even know this myself. Next slide. When it comes to healthcare spending, so we've shared with you the dollars, but the US spends more as a percentage of GDP on healthcare than any other developed country in the world. And that gap has been increasing. Part of that is we are seen as a wealthy country. And you're going to hear us talk about some of the other things that come into play with that. But with that, as we move to the next slide, we don't necessarily see the same quality. Many people have different opinions on this. We could talk about our healthy lifestyles in the US or not. Perhaps there are issues and equity issues, as some of you are studying in the healthcare system. But you can basically see that if you compare the US health life on the right-hand chart to many other developed markets, our life expectancy is not the same. So we're getting less years for the dollar. Next slide. Which is probably one of the things that leads to perception, and anybody who's had to go to an emergency room or move states, which I can share, my daughter moved to California and finding doctors was not the easiest thing, is the the perception of healthcare is not particularly strong. So as you look at this chart, you could see 16% of people believe that we are in a state of crisis. Major problems are seen by 54% of the people, and only 25% of the people see that there are minor issues. What this means from a financial standpoint, if you just think about these slides, and that's the last slide, is that in the US, and many countries spend a lot of money, it can be the number 2 spend, and many other countries are just not as wealthy. We spend a lot of money, we're not getting the same outcomes. Why is that? And as we think about how we improve the system, not only is there the issue of managing the money, but how do you choose where you're going to invest, and how are you going to make that industry better with better outcomes for people? So the slides can come off the screen now. We're going to go ahead and move into questions. So hopefully that helps sets a little bit of the stage. And one of the big takeaways for people on the call is that the healthcare industry is huge. And so as we talked about this call, what do we want to talk about? The first thing we thought might be helpful for all of you is to understand, where do we all play? I can speak to, there was no College of Health when I graduated, and I didn't even know it was an industry. And so, one of the questions I have for all of you is, how did you even find your way into healthcare? We all had very different paths. We have very different jobs. And how do you play in the finance segment of the industry? So why don't we go first? Because I see Josh and he did the slide. So thank you, Josh. Men first.
Yeah, I feel like I'm rarely outnumbered in these things, but thank you, Kendall. So, yeah, I was a math major at Lehigh until I took my first exam, and then I switched to the business school, and the path of least resistance was accounting. So I went Price Waterhouse, did the internship, got the full-time offer, ended up in audit. And I had never heard of equity research or sort of finance or any of that. I understood a little bit of finance, et cetera, but I didn't really have a lot of exposure. And so, I loved everything about my experience at Price Waterhouse except for the actual work itself. So that wasn't sustainable. So I went out and tried and find a job in finance, and I did that. I started at Morgan Stanley briefly, and then I went to Lehman Brothers, and I helped start a healthcare services team back then. And what I would say is I kind of lucked into healthcare. I think when I was looking at opportunities, there were a lot of different things that resonated with me. I think healthcare is one of those areas where I'd say maybe technology is the other sector where it's a huge percentage of GDP, call it, north of 15, really close to 20%, and grows faster than GDP, right? Over the last 60 years, healthcare has grown about 2 times the total growth in the economy. And so I love the idea that it was constantly changing, that it was a huge opportunity, that there was a lot to do. But I will say, when I, was in the seats of the students today, to your point, there was no College of Health. I had not really contemplated healthcare. I think I just got lucky in the end.
Denise, how did you wind up in healthcare?
Thanks, Kendall, and hello, everyone. It's great to be here. So my career has taken a very, very weird, twists and turns, and I always say it's always important to keep doors open. So I started at Lehigh as a pre-med major, and as we all know, Lehigh didn't necessarily have a formalized pre-med major, so most of us took on the path of a behavioral neuroscience major, which was offered through the College of Arts and Science, because just like Kendall said, there was no College of Health when I was at Lehigh either. And so that was a major that really put together all the various sciences that were required in order to apply to medical school. I was the daughter of the doctor, so in my mind, I was going to be a doctor. Loved looking at healthcare, loved policy issues in healthcare, took a couple of policy classes at Lehigh. And then ultimately, I decided to work in healthcare for a while. A little bit about me, a weird sort of fact is that I'm actually germophobic. And so probably a career as a doctor was not really where I should go. And my father was a doctor, didn't really want to tell me that was not the case because he knew I was stubborn too. So I worked in the healthcare field for like 2 years while I applied to medical school. And I realized there was a lot about the policy side of healthcare that was very interesting. And at the time, managed care was coming into play, and HMOs, and there was definitely some issues with pertaining to patient rights. So I decided to go to law school to be an advocate for patient rights. And then I ended up becoming a corporate lawyer instead. So go figure. I had law school loans to pay back. And so I basically was on the M&A side and public markets, capital markets side. And then went in-house for a health and wellness company called the Hain Celestial Group, which was focusing on organic food products. I did that for a number of years, and then ultimately found my way back into the healthcare industry, going to work for Freya, which is now Tilray, which is basically at its core a medical cannabis company. We participate in over 20 countries around the world. And we look to how do we bring affordable, accessible healthcare. We do clinical research on a lot of conditions. And part of that research often is also how do we supply a product that might be more accessible and more affordable than a traditional pharmaceutical product. So here I am today, and nice to be here.
Well, we're glad you're here today too. Pam, how did you wind up in healthcare?
Well, so I graduated from Lehigh, and I had no idea what I wanted to do, like I'm sure many people going into college. So I went into consulting, and I have been at Accenture for 36 and a half years now. And conveniently, in consulting, you have an opportunity to see a lot of companies and a lot of things, and learn a lot, challenge yourself constantly, which is why I've been here 36 years. I've probably had 15 different jobs, but my most recent job is leveraging that finance background, and I do what I call leveraging my finance powers for good now. I work at a client, and this is my second client in the healthcare space for Accenture. It is our largest healthcare client. And I feel and I believe that my consulting expertise and my finance expertise is helping to support a client make the changes that need to be made to survive this challenging world in which healthcare is in, with incredible cost pressures and demographic changes and government and regulatory challenges. And we, as an organization, Accenture, at this client, are in fact doing those things. And I also went into this space and pushed into this area of consulting when I had a major health issue affect myself. Right after the birth of my son, I was diagnosed with epilepsy, which 15 years later, we found out was in fact genetic when my son was diagnosed with it. So as my husband likes to say, he got the bonus package with me. And I am using my need for healthcare, my significant need for healthcare in many things, followed shortly thereafter by the breast cancer that I'm now a 2-year survivor of. I am using, again, my finance powers for good and my consulting powers to help a client tackle the challenges we are only going to continue to see facing.
Well, Pam, we're happy that you're doing well, given what you've gone through. So it's interesting you say. I'll just share with everyone that I'm actually a corporate post-grad. I hate that word, from J&J. A number of years ago. I had many jobs there too. And what I would say for those of you on the call is you see that huge employment. You just heard 3 very different types of roles. I worked for a major healthcare company at Johnson & Johnson, and I was never going to be a scientist. I was probably not great at chemistry. I was not in the College of Engineering or Sciences. And in that market, there are many things you can do and influence. Denise talked about policy, right? Josh is heavy in research and helping people understand how to follow the data. There are many roles where you can engage in trying to improve the industry and making a difference for people, whether it's supporting scientists, influencing policy, consulting with an actual provider. There are many ways that you can participate in making it, which we believe is what all Lehigh students and Lehigh. So real quickly, before we move into sort of conversations about the market for the audience, Is there anything specifically you want to share about your fiduciary responsibility? Certainly for me, I had to sign off, for instance, Sarbanes-Oxley. I had to worry about income statements. I had to worry about, pricing policy and meet with customers on contracts. What about all of you?
Well, I
Okay.
can start. Oh, sorry.
I can highlight that obviously I'm in the consulting biz, and we are selling our services to a client. We have to make sure that we are paying our people, because Accenture is primarily a people business. So it is my job to make sure we are successfully selling and paying our people. But that is balanced by a fair and legitimate price to be given to an industry that is not what I would call a profit centric. My client is actually a nonprofit, so it's a fine balance of delivering services for a fair and balanced price that supports. Again, I like to think I use my finance powers for good with a client that needs to make changes.
Denise, why don't
Yep, great. Thank you, Kendall. So I've approached my career looking at how can I live up to a purpose? Because, in addition to business, which is important, I've always wanted to do things that were purpose driven. And so when I approached this field of medical cannabis, I was thinking about it from a couple different perspectives. First, I think, as we all know, in the United States, and it got worse during COVID, we have a very large opioid crisis, where just a lot of very high levels of addiction and death associated with opioid addiction. And we also, as those slides showed, we have highly rising medical costs, and prescription cost is very much a part of that. And so as I was thinking about my next career after I left Teen Celestial, I joined Aphria, which is now Tilray, thinking medical cannabis is an approach of a natural alternative to traditional pharmaceutical products. We looked at different ways of approaching pain and chronic pain and neurological pain and nerve pain, where typically there were, in fact, opioids prescribed, which actually aren't even that effective with certain of these conditions. And we conducted a study that showed how we could actually reduce the levels of opioid addiction, which we ran in Canada across 12,000 patients, to see how do we really reduce the reliance on opioids. In conjunction with that, we've done research on HIV, glioblastoma, CINV, several different types of epilepsy, all with very good outcomes in addition to neurological pain. And as part of that, as I mentioned in my intro, we also look at how do we, what is the cost associated with providing this as an alternative? And we compare that to the traditional pharmaceutical products in order to ascertain, like, are we providing a efficacious product at a very good value, and how do we make it affordable? So that's been a lot of our work and how we think about things, and we're going to continue to think about this going forward.
Okay. And Josh, I mean, you started your own company, so you'll have a different sort of, you have some day-to-day responsibilities, right?
Yeah, I mean, I think the good news is I spend 90% of my time doing healthcare research. One of the reasons we started the firm was just, there's a lot that goes on at big banks that isn't necessarily contributing to the process of helping our clients. And so that was the main goal. So far so good. We're coming up on our 9-year anniversary. And I think the beauty of what I do is really to spend all of my time thinking about healthcare and, where the sector is going and all the different moving pieces.
Okay, so let's talk a little bit about the market, right? So we talked about this. The market, the U.S. spends a lot more compared to other countries. Pam and Josh, given your roles in sort of research and consulting that you've been in, why is that? What do you see as the drivers on this? And we'll start with Pam.
Yeah, I mean, a lot of it is fundamental infrastructure and the way in which the model works, and the way it's been built over years and years and years, as well as, unfortunately, a very aging demographic that is facing significant health challenges, and a demographic coming behind it that is not as large. So it's a lot of cost pressures related to that. We need a fundamental shift in how we deliver care, because there's actually also a fundamental shift in the care needed for the changing demographics. If you look at the younger generation, behavioral health is the highest growth area. Figuring out how to support that is a huge change. There's a change in how people want to get their care, not from a hospital, but from different sites of care, more ambulatory. So that's a huge infrastructure change for many of the organizations that are out there. There's a drastic change that everyone's seeing on a daily basis in the data that's available. AI providing more information and the data that's available to these organizations, just going, okay, well, how can we use this and change for the better in an ethical way, which is incredibly important. And the pressure of our own government making changes in, sadly, real time. That is affecting every single person, certainly areas that are more rural in nature in even worse ways. I think there's just an incredible amount of cost pressure, and the clients that I work with, the client in particular that I work with, is really trying to evaluate, not only do they change how they grab a new demographic, a younger demographic that can support that aging one, and changing how they support and care for that, as well as changing how they support and care for the other demographics that exist, and change the way they deliver that care and gather the data so they can deliver value-based outcomes that will in fact truly help all of them.
So Josh, Pam noted some, just issues, I think, everywhere around the world and challenges, and some that are specific to the U.S. What can you add to that, given all the research you've done?
Yeah. No, I mean, I would just sort of, can I just say echo Pam? Yeah. So I think the only thing I would add is maybe shift just sort of why is healthcare so expensive relative to other, countries, and not, third world countries, developed countries as well. And so there's two sort of things that I would just point to. One is the obvious one is the U.S. has a public-private partnership where a lot of our healthcare is privatized, right? In foreign countries, most of the countries that are developed countries have government-run healthcare, right? So there are abilities to ration care, there are abilities for the government to say, nope, we're not going to give it to you, and all that sort of stuff. That, in theory, happens here, but ultimately does not happen here, right? We have a much more open system. And people want to spend more money on healthcare. I don't think we have a healthcare crisis. Everyone talks about healthcare, 20% of GDP. We have this healthcare cost crisis. I disagree. I think, look at the baby boomer generation. People want to spend more money on healthcare, wellness, feeling better, play golf later, all that sort of stuff. The second thing I would say is if you look at the data, the biggest difference in the United States versus other countries is unit cost. We pay more for a unit of cost than anywhere else in the world, right? And everyone points to pharmaceuticals because that's very easy. You take the same pill here, take the same pill in Canada, you pay 3x here, or Europe, or whoever you want to pick on, right? But that's the same for X-rays. That's the same for all sorts of costs within healthcare. I know everyone thinks that doctors don't make a lot of money in the United States, but doctors are making, on an adjusted basis, almost as much as 2x what they make in European countries, as an example. So I think the issue is one, the public-private partnership, and then second, the unit cost. The last thing I will say that always gets lost in this conversation is we don't talk about innovation, right? We are getting something for what we're paying for, right? If you think about the, again, let's look at the pharmaceutical industry, and I know, Kendall, you'd be better at explaining this, but just the innovation and new drugs coming to market and the success we've seen. The U.S. pharmaceutical industry is unmatched. There's great successes in some of the European pharma companies. Japanese pharmaceutical companies have been successful. You've seen other countries sort of picking up the pace, but for the most part, a huge majority of the innovation has actually come out of the United States system. And so, we could argue we're paying more for it, and it costs a lot. But I would argue, we're also getting some of the best healthcare and creating value for way beyond our own borders in that respect as well.
Yeah, I having been in medical devices and pharma for most of my career, I think one of the interesting things for those of you on the call is that if you went back to when I was a kid, 40 or 50 years ago, most people died in the U.S. of heart attacks, right? And statins were invented. And if you went back 25 years ago, breast cancer, prostate cancer, many cancers were a death sentence. But because of medical devices and pharmaceuticals, a lot of those things are no longer the killers. Frankly, the leading causes in developed markets now tend to be much more neurological, right? I mean, you get into lower cost countries, car accidents is a big issue, and accidents are a big death driver in developing countries with a lot of construction. So there are fundamental differences around that, and we may spend 10% on pharmaceuticals or on drugs in the U.S., but we shouldn't be spending it. We're not spending it anymore on all the ambulances picking up people on heart attacks who died at 40 years old, although there still are some, unfortunately. So I want to actually use that to pivot, though, to one of the things, neither one of you specifically mentioned it, but it is one of the things, and it's interesting when you look at oncology, how this has changed, is one of the big differences, and I know, Denise, you and I talked about this, is sort of the clinical and regulatory pathways. There's a lot of people involved in this, right? And what the government puts on top, and I'm going to ask Denise to talk about the structure, but, that can delay or speed up how quickly products get to market. And if you look at some of the life-saving approaches to cancer today, many of the reasons they're getting to patients faster is because they've rethought the regulatory pathway, because they see data, getting to data analytics, they see data that is compelling around saving lives, and they don't want to wait for the traditional, 5-year study. So Denise, can you talk a little bit about how you see, because you're very much more global, because US is a challenge. So how do you see clinical and regulatory pathways sort of driving some of those costs?
Yeah, well, so you're 100% right. The path for new drug development is very lengthy and very expensive. And part of that is really a necessity, because obviously you have to prove out efficacy. And so the way to do that is oftentimes you need to be conducting clinical trials that basically, have patient groups with placebos and actual product. And you have to have these very expensive trials that, and it goes through several phases, proving both efficacy and safety. And making sure that you understand what contraindications are and whether there's certain parts of the population that shouldn't be, treated with such medications. And so that process in and of itself creates a structure and a process that is not just in the millions of dollars, but it also takes a lot of time. And so if you think about upfront investment, and you talk about businesses, companies have to fund those studies, and oftentimes may not even know if the outcome is going to be successful. And so for every clinical pathway study that's done for new product development, there might be several in the background that have failed. And so when you think about the cost of a new drug, it's not just the cost of getting that new drug there. It's almost also funding all the ones that may have failed, or all the sort of fits and starts that may have happened along the way. And then as you think about it, every country has a different regulatory pathways. Certain countries do accept clinical data from others. So us being in the United States, and for a lot of the reasons that we talked about before, Josh, you talked about innovation and coming out of the United States, we get a lot of deference in other countries around the world in terms of the clinical studies that we conduct here. The inverse is not true, though. So if you conduct a study in a country in Europe or in Australia or in Asia, you oftentimes have to replicate the study here in the United States. And so drug companies are having to do sometimes duplicative work in multiple countries in order to get registrations for those products in other countries. So all of that creates just the time and the money and the resources invested, which I think ends up ultimately in the cost per unit in the drug that actually ultimately gets registered and prescribed.
Okay. So one of the, I'm going to jump ahead to value-based care here, given where we are right now. One of the hopes in the US to sort of improve costs and outcome is to shift to value-based care. I know Josh and Pam, you both have a fair amount of experience in this. So Josh, why don't you, share with your thoughts in terms of what has been learned about value-based care over the last couple of years, and where do you think it's going?
Yeah, this is from, I'll give you the perspective of someone who thinks fee for service is the root of all evil, right? So if you want to spend a lot of on healthcare, you can create incentives to do that. And if we pay providers every time they see a patient or perform a service, then we're probably going to spend a lot. So we wrote a piece, it's now 5 years old, about a report called The Dawn of Physician Enablement. And the idea was that there are these companies that are being created that are going to be able to take advantage of the value they create by providing higher value costs relative to some fee-for-service benchmark, whether that is, explicitly the Medicare fee-for-service, benchmarks, or some commercial benchmarks. And the idea was that these companies were going to come in and they were going to sort of disintermediate the health insurance companies as the coordinators of care, right? If you think about it, life insurance is a good example, where life insurance companies make money one of two ways. Either they earn more on the investments that they make, or you live longer, right? And they don't have to pay you out as fast. They do a lot on the first, right? They're always, they're trying to figure out better returns. They do zero on the second side. They are not in the businesses of managing life, right? They do absolutely nothing. They don't send smoking cessation kits, right? They don't pay you more for, safe driving. They are purely financing mechanisms in the insurance business of life. Health insurance companies are tasked with the idea of managing care, right? And I think that's part of the problem, right? And the biggest issue is just trust, right? When your health insurance company calls you and says, hey, Josh, we'd like you to see a specific provider, the amount of doubt that creeps into your mind, right, is palpable, right? You're thinking, oh my gosh, this must be a terrible doctor. It's probably the cheapest person in the neighborhood, whatever it is, right? There's no perception of quality. Everyone sort of hates the entirety of the idea. If your doctor calls you and says, hey, Josh, I'd like you to go for a follow-up with Dr. Smith, and she's got an appointment for you on Tuesday at 2:00, you say, great, I'll move everything around and I will go see her at 2:00 on Tuesday, right? And so what the idea of value-based care and sort of this whole idea of physician enablement that we posited was that these companies were going to come in and they were going to be able to better to create more value in the healthcare system. And that doesn't necessarily mean rationing care, et cetera, but by setting up incentives to get people, healthier and more proactive care and to more effective providers, right? As opposed to the number one indicator of quality for a physician in the United States today is word of mouth, right? That's not particularly data driven, right? It's just, you needed an orthopedic surgeon, you asked someone that had knee surgery last year, and that's how you end up, right? So there's a lot more work that kind of goes into it. So I think we're I would have said we're on the precipice. I think COVID set us back a little bit. The healthcare system and the disruption that we saw there was difficult. But I do think we're seeing more and more effort to try and coordinate care, and we would consider some of these value-based arrangements. And if there's specific questions, I'm happy to get into primary care versus specialists and some of the specific conditions and disease states, et cetera. But that's the main thought.
Pam, you've directly consulted with some of these providers who are working to try and improve this. So is value-based healthcare the answer? What have we learned, good and bad?
It's interesting. I'll actually highlight a personal experience. I, as I mentioned, had breast cancer, was diagnosed just almost exactly 2 years ago. And the care that I received and have received over the course of the 2 years has been focused on the outcome, the successful outcome of my care, and how to understand me, what I've been through, what I have as pre-existing conditions, and to make that outcome better for me. As you said, Josh, the putting the care in the hands of the provider, I think we're actually, like you, on a precipice of really starting to focus on that, because the demographics are starting to look at it. They're starting to push for it. GLP-1s are a perfect example. Someone is saying, I want to live longer. I want to be healthier from 80 to 90. How do I get there? Well, maybe a GLP-1 is a start, but you have to put all of the pieces around that. And if you don't have all the pieces around that, then they're not going to be there. So yes, as in my client today, we are actually focused. They are focused on changing the model to become a value-based care provider, to be more of a provider-driven versus payer-driven organization. And as a result, in order to do that, they have to try and change the model. They have to look at and truly transform their organization to help cut costs where possible, to put the hands of the providers and not hamstring them, to give them what they need to be able to do that. So I do think, like you, Josh, there is a shift. There's a shift because of the cost structures. There's a shift because people are sick of being denied, and they want to change it for the future. Consumers do have power, and they are starting to push for that and to ask for that. What am I getting for this? Am I going to be better? Am I going to be healthier? And are challenging the providers to do that, and they want to do it.
Thanks. So you both talked about healthier. It's interesting, when we put up that chart of 5.2 trillion, there isn't a nice big pie that is really about wellness, right? And prevention, how to invest before people get sick. Hospitals is the biggest, before they need to go to the hospital. And people talk now about health span. I want to have a healthier, it's not my lifespan, it's my health span. So, if prevention actually should, stop you from being so sick at the end, why aren't we investing more? What are the challenges there? And I can add some thoughts on that. But Denise, why don't you share some of your thoughts on that?
Yeah, great. It's interesting because if you go back 20 years ago, there was an emphasis on preventative care. And everyone likes to use the word managed care, preventative care, but there's really very little done at the medical level in terms of preventative care, other than conducting various testing that just, is generating like fees. And coming out of COVID, and Pam talked about this shift in the consumer mindset, the patient mindset, and it's 100% true. Like, coming out of COVID, there was an emphasis on self-care and wellness. And right now, the number one trend in consumer product goods right now is in fact longevity. How am I going to find a way to live my life longer, do the things I want to do longer, and be able to really exist in the way that I want to exist longer, so how am I and so patients really are starting to look inwards and saying, I'm going to take control. And I think we see that in the rising use of AI in terms of healthcare. There's a ton of research online about wellness, about longevity, and people hear about like peptides and all different types of supplements that are all progressing toward looking at longevity. And these supplement companies are, if you look at valuations, are really just going through the roof. And you also see the rise of online telemedicine platforms where patients are going online and they're seeking their own solutions for what they believe are like ailing them or is going to improve their life and help them live better. And so if you look and the valuations, like, so market caps, I was looking at like basically like Hims and Hers, which is one of the leading like telemedicine platforms. I mean, basically they have 2,000 patients, but valuation was as high as like 7 billion at some point. So you see the proliferation of these types of platforms where patients are really taking their healthcare into their hands, and wellness, I think, is starting to really grow. And in fact, I don't think it'll ever eclipse healthcare because of all the various, structural things we've talked about, but it certainly is increasing.
Yeah, so I'll just make a comment on wellness, and then I want to talk briefly about global public health before we get into Q&A from the audience, and why more isn't invested in global public health. But from a wellness standpoint, my perspective as having been in the industry, and for a while, J&J actually was investing in wellness and going to employers around this. It's financial incentives aren't generally aligned, right? And we're not going to have time to really go into the supply chain today, but if you look at the US versus many other countries, in other countries, as Josh mentioned, it's usually government funded, right? Everyone has access to healthcare. But there are the providers, meaning there are the manufacturers of product, and then there are government employers, and there are the patients. There's not a lot of people in between. In the US, there's the manufacturers, there's the research that all goes before that, which can come from there's manufacturers, there are, that gets shipped to distributors, that gets shipped to pharmacies if we're talking about drugs. If it's a medical device, that gets shipped to the supply chain. And then you either show up at Walgreens or CVS and you get your drug, or you might get your drug in a hospital because you're staying there. And then in the hospital, you've got doctors who are employees of the hospital, you have ones that are private. I mean, so many people in the system that, and then Josh talked about insurers, right? And how they play. And so if you use something around wellness and you say, well, if this patient has this surgery today, it doesn't matter what it is. If they have this surgery today, we anticipate based on the data that they're going to live 25 years longer. A healthcare company generally doesn't look at that and go, that's great for me, because you know what? Pam may be with a different healthcare company, healthcare insurer, when you get that return on investment, right? So I'm in finance, like I do the analysis, and yeah, that might not be a good investment if you look at that one person. But if everybody was doing it, it'd be a great investment, right? And not everybody plays by the same rules. So there are infrastructure challenges beyond behavioral change challenges. But what I want to talk about global public health quickly is I had responsibility for that for 5 years. I was the CFO of public health, global public health for J&J, and it runs into some of the same issues and many students are studying this public health and access and equity, and you may be on the call, is that when you talk about how you should be investing in vaccines around the world, polio is virtually eradicated with the exception of 1 or 2 countries in the world, and that's because of vaccine. Well, who's going to invest that and who's going to get the money? Is oftentimes that's the way people think about it. It's governments and private foundations. The Gates Foundation is a big one, who see the bigger picture and the greater good. And so how, we think about using data, et cetera, that was always a challenge for us at J&J, getting people to help us, because we were willing to invest, $100 million, $150 million in global public health, but getting other people to do it wasn't so easy. So Josh, I'm going to ask you this question before we go to Q&A, because you're the research guy who often influences this kind of stuff. How do we get people to want to invest in wellness and in global public health, and how could our students think about that moving forward?
Yeah, so there's, investment in healthcare is interesting. We spend a lot of time with private companies, even venture-backed companies, et cetera, and it is overwhelming how many of these companies were started by someone who had a healthcare experience, right? So the simple answer to how do you get people to invest is, okay, well, you need a regulatory framework that's very steady so that people understand. You need, all sorts of ways to lower the cost of capital, right? To get people to invest their capital. Healthcare doesn't necessarily work like that. It is a tricky area. But what's interesting is it's personal for a lot of people. There's a company called Vitalize. It was actually started by two Lehigh alum as well. I'd recommend everyone take a look at that one. And it's just all of these stories that kind of say, okay, well, how do I make the healthcare system better? And I think the good news is it's a roughly $5 trillion industry, right? It grows faster than GDP. There is so much opportunity for returns to that. But I do find the most successful people are the ones that have some form of passion for what they're doing. And I think healthcare is actually an easy place to do that, right? I sort of joke that I've got a friend that worked in the airline industry before healthcare, and was like, it's probably hard to be like super passionate about getting people to their gate faster, or, from gate to gate, whereas in healthcare, you wake up every day, you can see the difference. So, I would say, as I said in the beginning, I'll sort of bring it back full circle. It's like, I kind of got lucky and ended up in healthcare. I think if you're thinking about that as an opportunity, as a career, but it's really hard to argue that there's better industries, to sort of start your career.
Yeah, and I would add for anybody who's on the call who's a business and healthcare major, is thinking about how you frame the investment for the long term, right, and not just the quick fix. I think Josh talked about people who started companies, and that a lot of times they're not thinking about what I want now. They're thinking about the greater good and how they can make a difference, and you need to move there. So at this point, I'm going to encourage people to add questions. I will say we do not have a lot of questions, but we're going to start with one. The one question we have, which didn't really come up, but we should talk about, is we're not doctors, but through the financial lens, as we think about the costs in the U.S., what are anyone's thoughts on the U.S. diet and lifestyle impacts on the cost? And how do we look at leveraging improvements, those which help, overall?
If you're referring to the fact that in other developed countries outside of the United States, you can go there and the food product has less additives, certainly healthier for you. There's fast foods are practically non-existent versus here. I think that it has to sort of come again from the consumer and the and the government, which we're kind of in a rough spot there as in regards to both what you talked about, vaccine conversation, as well as environmental protections around making better decisions in regards to food additives, things like that. They are absolutely challenges that just simply don't exist outside of the United States. And I'm sure, Josh, you can highlight that probably more dramatically from a research and analytical space. But I think that it has to come from us, right? It has to come from the buyer. It has to come from the individual to put pressure to do those things. I often say that I live in California. I often feel that I am in a land of my own and in a great little bubble by which I live. I'm highly educated from Lehigh, have had a great deal of experience. I've been through major health issues myself, and food, taking care of myself. I had to change my career when I was diagnosed with epilepsy inside Accenture. I was a consultant. I traveled 4 days to 5 days a week. Suddenly, I didn't even know if I could drive ever again. I needed to buy a home in the city so I could walk everywhere, because my life had to change due to the way it worked. Now, the good news is that now I walk everywhere. I sleep better because it's a priority for someone with epilepsy to make sure they have less stress and sleep less. Yet I still got breast cancer. I eat healthy. We as a country need to be educated to understand this, and we need to help our legislators, our government, our state and local officials, our governmental officials understand this is not the outcome that exists outside of the United States. It exists here, much more so, unfortunately.
And unfortunately, it's increasing in wealthy
It is.
countries. Anybody have anything to add to that?
So I can add just very briefly, I can add, I just want to concur in what Pam was saying. Like, I spent, 14, 15 years in the natural and organic food industry and personal care. And so just as important as what you eat, what you put on your body is also very important. And what we learned, we spent a lot of time working with the FDA, HHS, CIPSAN, really trying to understand our food chains, our supply chain for food. Understanding the fact that, in this country, we introduced pesticides into our soil that really stay for a very, very long time. Like they don't just go away, they stay in the soil. So there's heavy metals that we need to be thinking about. There's pesticides, preservatives. There were a lot of things that were introduced post-World War II into products, whether it's food or other aspects that touch our lives, whether it be building materials, clothing materials, furniture, chemicals that were not necessarily tested and given a generally recognized as safe certification, which exists today. And so if you think about our society, not understanding what we were introducing into our various supply chains probably is a result of a lot of what we always thought of my former company was the result of a lot of healthcare issues that we see today, whether it be cancer, whether it be, some of the developmental diseases that you see in children.
And I think there's also, thank you for sharing that. I do think somebody's going to do a study at some point around the way the human brain works, because with the GLP-1s that are out right now, it's amazing how many people are running to him and hers or wherever they can to get a GLP-1. And there are many people who are heavier because that's their natural state, right? And they're fit.
Yes.
But there are a lot of people who are going to it now because they see it easy, right? Versus having done the work. And I'm not sure what that says about our society, but hopefully some of the people who are studying global public health and population health will be able to influence and find the answers to that, right?
Yeah.
So I think there's a lot of factors that do come into play there. Quick question for all of you: is there any advice? We all said we didn't necessarily think about going into healthcare, but for the people who are either thinking about changing into the industry or they're getting ready to go into it, what's a piece of advice that you would give to them around, getting into healthcare or how they think about being in healthcare, specifically in finance, but you could talk to healthcare in general. Let's start with Josh.
Yeah, I mean, I sort of gave a little bit of the thought earlier, in terms of just massive opportunity and it's exciting. And, I sort of joke with people, the best thing about this job is you could do you could work 24 hours a day, 7 days a week and not finish it. That's also the worst part of the job, that you could work 24 hours a day, 7 days a week and not finish it. It's just that there's that much sort of work and excitement to do. I also like just sort of the diversity of opportunity, right? I mean, there is everything from the delivery of care to, the financing of care. And like I said, it's a $5 trillion business. So I think if, it's funny, I've talked to Dean Dolan about this in the past. It's just, we're looking for students that have a financial background, understand, all of the finance, and then, boy, to understand pop health and, getting the healthcare, that sort of integrated business and health degree. I wish that existed, a long time ago. I would have hired, dozens and dozens of these kids. And I half joke, but I've got a firm, we've got 18 people, 5 of us went to Lehigh. So there's a very obvious bias in our hiring, but I just think, that sort of preparation, I think, is going to be great for all of the students that go through that program.
Okay, but before I have Pam answer that question, Jen, you raised your hand. I think you have to type your question into the Q&A if you want us to answer it. I can't actually see you. So if you could type your question into the Q&A, we'll try and answer it before we get off. Pam, any quick advice you have for the students?
I mean, I think I said it. I had no clue. When you're 21, you got no clue. So I went into consulting, and I have not left, right? I'm still at Accenture. It's a 800,000 person company, and I've had many, many jobs inside this organization, and I have had many challenges in my life. The good part about a company that's people-based is that you meet people, you build relationships, and then you can leverage that as your life changes and as challenges slap you upside the head and say, sorry, can't consult anymore, can't drive, gotta walk. So I think that, take a look, give something a shot, do something that's passionate. And then one thing I am telling my children and also people who ask, in this crazy new world where AI and computer science degrees are sort of falling off the cliff, human-based and human-centered work is only going to continue to grow. Find a job where you're gonna talk to a human, where you're gonna benefit a human. My daughter is interested in nutrition after yet one more health crisis shock a teenager who suffered from an eating disorder. Thank you, sir. May I have another? But now all she wants to do is teach other young women how not to, right? So find something that involves humans, because, or in the AI world, find the data model area where it's going to support and help humans. And healthcare is one of those without a shadow of a doubt. Oh, I think we lost you, Kendall.
Denise, anything to add on advice?
Sure. So I said at the outset, my career has taken a lot of different turns. And if I think back on my career, I've kind of approached healthcare in a lot of different areas and ways. I approached it on the legal side. I've approached it on the policy side. I've actually approached it on the running a business that was providing pharmaceuticals. And in my M&A world, what I look at is like, what are sort of the gaps in capabilities, and how do we fill those in terms of M&A? And then, of course, how do you pay for them? And like, what is the ROI on that investment? So my career has taken a lot of approaches. I think Josh said it before. There's so many facets to this industry and the business of health. And so there's a lot of opportunities. And my piece of advice is, even if you get into one area in healthcare or somewhere else, just keep your eyes and ears open, because life takes you down a lot of different turns. And And it keeps things very interesting for sure. I've learned a lot of things in my career, and I've learned a lot of things today. So thank you.
And what I would add personally for all of you is that if you want to be in healthcare, you should want to make a difference for the people that are patients. And one of the best things anyone said to me when I was only a month out of college was, I was a consumer, or I was a patient. Pam shared some of hers. I've been a patient, and you likely have a suture, or you have a parent who has a joint, or you have a loved one who had cancer. And so the privilege of being in this industry is that you can do something to hopefully make it better for someone else. And you don't have to be the healthcare expert. I mean, my gifts are financial and strategy, and, being able to take a lot of information and get down to one thing. That was really helpful for people who were brilliant and scientists, or brilliant doctors, or nurses, and I could help them do what they needed to do because they were good at treating patients. I could help them figure out how to get the money, or whatever the situation was. So it's an industry where you're doing it for humans, and you have to work well with the humans around you in the spirit of how to help them serve those humans well as, additionally. So with that, I know it's 1:17, but it doesn't look like we have any more questions. I've tried to pepper them in. I want to thank these amazing panelists for being here with us today. I hope those of you on the call really enjoyed it, and I'll turn it over to Beth for closing remarks. Dean Dolan, to me, Beth, Dean Dolan.
Yeah, either way. Just want to thank each of you, Kendall, Josh, Denise, and Pam, for joining us. I mean, I think you guys make it clear that Lehigh has real strengths in health and healthcare, even that preceded the College of Health. And so we're just really happy that you're sharing your expertise with all of us. Appreciate your support of the Integrated Business and Health program. We're very excited about seeing where that will go and seeing what the students in it end up doing. So anyway, thanks everybody for joining us, and hope to see you on April 7th. Thanks.
Hi, everyone.
Thank you. Bye-bye.
Thank you.